Dr. Christopher Gay. I'm an anesthesiologist specializing in interventional pain management. Went to med school at University of North Carolina in Chapel Hill. And then after that, I went to Columbia University in New York to do anesthesiology and specialize in pain management while I was there. It looks like there's a lot of opportunity to help other people in this community that are also in pain. And also, hopefully we can focus on treatments and interventions that also minimize the use of opioids to manage that sort of pain here as well. They're just masking the symptom of pain. They're not really getting at the cause of the pain. A lot of the times the cause of the pain is inflammation or something that can be actually treated. And so what we can do with interventional pain management is we can actually find the source. We use MRIs, whatever, imaging, physical exam to figure out what is most likely causing it. And then we can put targeted treatment directly on that area. So if you have a disc herniation that's bulging out and pressing on a nerve, we can pinpoint that nerve and put a very strong anti-inflammatory or steroid right on that to reduce the inflammation. So what we're doing is not injecting a painkiller. It kills the pain as a side effect of the treatment, but it gets rid of that inflammation for some period of time. Sometimes the pain persists, and we have other treatments that we can invoke, spinal cord stimulation, other therapies that then, when we've identified there's nothing actively causing the pain, but the nerve has decided, I'm used to having pain, I'm going to tell the brain to have pain, we can actually shut off some of those signals when we've identified there's nothing at risk. One of the funny things about pain management is that you listen to people complain all day, right? Every single person that comes in there is going to say, hey, I can't do this, I can't do that, I have pain when I do this. And so when you get those people to come back and say, hey, I can do this, it really is like a adrenaline boost. It's like, this is why I do what I do. I can make you feel better, I can make a difference. So when I see someone out doing things, or they tell me I was able to go to the graduation and see my grandchild graduate, or I was able to go to this wedding and walk down the aisle with my, those types of things are very meaningful. My hobbies are not necessarily outdoor hobbies. I'm actually, I'll say, amateur musician. And so I play by ear, blues, jazz, gospel, you name it. If I can hear it, I can usually play it. A lot of the stuff today is really electronic and it's hard to reproduce that, but the old music's better anyway. So that's my outlet, playing keyboard, piano, organ, and live music. My wife gives me grief because I like to watch documentaries. I just like to learn new things about places, new things about people. And so again, I enjoy hearing stories. We don't always have time to listen to the full story of your life, but I love to hear little snippets every time people come in and they tell me something that's meaningful to them. That's great for me.